Hello everyone, our topic today is application of state of matter and chemical equilibrium in pharmacy. So these are our group members. Before we dive into the details, it is important to understand that in pharmacy, the physical state of a drug plays a major role in how it is formulated and how stable it is. The state of matter mainly applied in designing drug forms. Generally, drugs can be grouped into three types of form, which is solids, liquids, and gases. Each form has its own purpose depending on the patient needs. For solid forms, we commonly see oral solid doses such as tablet and capsule, which are the most widely used. These type of drugs are preferred because they offer precise and consistent dosing, and they are also much more stable, giving them a longer shelf life. But of course, they have their own drawbacks. They are not suitable for everyone. Some patients may have dysphagia, which means they have difficulty in swallowing, especially children and the elderly. Then, solid usually take longer to dissolve, meaning the absorption is lower than liquid. This is because solid drugs need to survive the acidic environment in the stomach before they can be absorbed.
Next, I will explain to you guys the state of matter, liquid, and ophthalmic solution. So why do we choose liquid and ophthalmic solution? It is because it gives the uniform spreading over the eye surface and the precise dosing, which is 25 until 50 microliter per drop. So to make ophthalmic solution, we must have this characteristic. So the first one would be the sterility, free of microorganisms to prevent eye infections, and then appropriate pH matched with natural tear fluid, which is pH 7.4, tonicity, isotonic with tear fluid, 0.9 sodium chloride solution, and viscosity, optimal viscosity is maintained by thickening agents. So how does it really work? Number 1, solution is applied directly to eye surface. Number 2, active ingredients are absorbed into eye tissue or bloodstream. Number 3, applying pressure to tear duct can minimize the side effects. Types would be, there are antibiotic eye drops and also lubricating eye drops, which is also called as artificial tears.
Now, I'll be explaining the gas state in pharmacy, focusing on why gas is used and two main drug application. First, why gas? Gas drugs work very fast because they enter the lungs and quickly move into the bloodstream. They are also easy to control. We can adjust the concentration instantly, and since they are inhaled, they are non-invasive and can act directly on the lungs. The first application is inhalation anesthetic gases. These gases are used during surgery to help patients lose consciousness safely. For example, it includes nitrous oxide, bisfluoride, and sevoflurane. They are preferred because the effect starts quickly and can be adjusted easily throughout the process. Now, let's look at the videos. You wouldn't feel any pain during the surgery. You might think you are asleep, but you weren't. You are under anesthesia, which is more complicated. You are unconscious, but also you couldn't move, form memories, or feel pain. Next, we move to the second application, which is heliox. A heliox is a mixture of helium and oxygen. Heliox is used for patients with airway obstruction because helium is lighter than air. It reduces airway resistance and allows smoother airflow, helping patients breathe more comfortably. Now, let's look at the videos. This is an example for asthma patients who need to take an inhaler regularly. So, in summary, gas state drugs are useful because they act quickly, easy to control, and can be delivered directly through the lungs. The two key examples are inhalation anesthetic and heliox.
So let's move on to the concept of chemical equilibrium. The chemical equilibrium is a forward and reverse reaction that occurs at the same rate. There is no change in the concentration of product or reactant. So we can say that in the chemical of equilibrium, there is a reversible reaction that occurs.
So let me proceed to the next application of the chemical equilibrium, which is the drug-molecular interaction. Drug-molecular interaction is the interaction between the drug and the target cell membrane, in which the drug will bind to the receptor, whether to activate or block the target cell. So to understand this application better, let me explain the mechanism of the propranolol, which is a drug that treats hypertension and the heart disease. So when the propranolol consumed by the patient, the high affinity of the propranolol will detect by the body. Thus, the equilibrium will shift to the right and propranolol will highly binding to the B receptor, resulting into more production and formation of the complex called propranolol B receptor complex. Thus, the higher number of the complex produced, it will increase the therapeutic effect of the drugs, resulting into the lower heart rate and also lower blood pressure. Until at one point, the number of the complex produced is at a constant, indicate that the reaction occurs is at the equilibrium, and after a while the propranolol will decrease its concentration, and yet the formation of the complex will also decrease. Thus it will shift the equilibrium to the left and decrease the therapeutic effect of the drugs.
So, in conclusion, the state of matters and how drug molecules interact helps pharmacists to create medicine that work as the way as the patient needs. These principles guide how a drug is dissolved, stays stable, and connects with its target in the body. This can make sure that the patient receives a safe and effective treatment to their disease. So, that's all from me. Thank you.